Well, if you're an older person who's finding that you could use a bit of a hand with life's everyday tasks around the house, but you're concerned about the costs associated with these types of services, or perhaps you know somebody who's in this situation, well, this is the video for you, because what I'm going to do is I'm going to step through about 7 different government funding programs that can be used to pay for these services, or at the very least, greatly reduce the cost associated with them. So let's jump into it. Okay, so first off, let me set the scene. There are 3 government departments that I'm going to be referring to that oversee these various government programs, okay? The first government department is called My Aged Care. The second government department will be Centrelink. And the third government department will be the Department of Veteran Affairs. So let's go to My Aged Care first of all and have a look at what are the programs that My Aged Care offer that offer some sort of funding that can be used to put towards home support services. So the first one I want to mention is the Commonwealth Home Support Program. So this is the government program that most older Australians find themselves kind of entering into by default, typically after there's been some sort of health incident, maybe a hospital admission, and the social worker or a nurse at the hospital has helped set you up. You can think of the Commonwealth Home Support Program as like the starter package to accessing government-funded support services. And it typically covers things like some very basic domestic assistance in the home with the cleaning, typically an hour once a fortnight, an hour to an hour and a half once a fortnight. You can get a little bit of gardening done as well, like lawn maintenance and some community transport on a community bus. But it really is basic services, and people are typically out of pocket, maybe $10 or $20 for the visit. Now, when I say basic services, I really do mean that. So when you think about the domestic assistance that comes to the home, what the person will do is give maybe the floors a light once over with a vacuum and maybe a little bit of mopping, tidy up the main bathroom. And if there's a little bit of time, maybe something else like hang some laundry for you or something like that. There's no heavy lifting or getting on ladders to clean windows. There's no moving of furniture. So for example, if you've got a coffee table that is in your lounge room, instead of moving the coffee table out of the way to vacuum underneath it, the support worker will go around it, because it really is sort of like a lightweight spruce up of the home before they quickly move on to the next person. For those people that are requiring a little bit more support, a little bit higher quality, a little bit more flexibility, the good news is the government offers another home care program, and that's called the Home Care Packages Program. The Home Care Packages Program will provide people with that added level of flexibility, but also a higher level of quality of services as well, and a much more personal experience. Instead of getting potentially a different support worker coming every fortnight under the Commonwealth Home Support Program that you would have to sort of show them around your place and whatnot. Typically those under the Home Care Package Program, you get to build a closer relationship with that support worker that's coming on a more regular basis, and therefore you can really get to know them. So the Home Care Packages Program, the funding works a little bit differently as well. So typically what happens, the funding gets put into a trust fund on a monthly basis, and every month you've got the various support services that you want to tap into, and it's the money from the trust fund that pays those support services directly. So you're not having to put any money out of your pocket. Of course, if you want additional services outside or beyond the amount of funding that the government is giving you, that's what you will pay for out of your own pocket. But in saying that, home care package funding, or those that are approved for home care package funding, the funding can be actually quite significant. And it falls in 4 different levels. So you've got a level 1 home care package. That's when the government will provide the consumer with about $10,200 per year, all the way up to a level 2, level 3, level 4. A level 4 package is paying someone about $59,000 per year. And this is money on top of any home age pension that you may already be receiving. Now, how can you use this money and what sort of things does it pay for? Well, really, it is quite flexible. So what will happen is when you get approved and assigned a government home care package, you will partner up with a registered home care provider, and they'll work with you to come up with a suitable care plan that might include things like domestic assistance, gardening, trips to shopping and doctor's appointments, help with loading groceries, maybe even some equipment that you might need in the home. Other common ways people are using their home care package funding is to pay for meal delivery services, and not just the typical one ones that you'd see from Meals on Wheels, but also meal delivery services of your choice, such as a common one that I see all the time is people spending their home care package funding on Light and Easy and other private meal companies as well. And the one that gets people by surprise the most is you can actually use your home care package funding to pay for allied health services, such as physiotherapy, podiatry, exercise physiology, hydrotherapy. And this is one specifically might interest people who are already tapping into those 5 free visits to an allied health professional that you can claim under Medicare, under a chronic disease management plan. But for many, 5 visits a year just isn't enough. Well, the home care package system can be used, that funding from that can be used to pay for additional allied health visits. Now, a lot of people I speak to are really, really surprised that this level of funding under the home care package scheme is actually even available. But put it in perspective, right? The government does not want people moving into a nursing home. The government wants people to age in their own home. Because when you think about it, moving somebody into a nursing home, that's a really, really expensive exercise for the taxpayer. And the government finds it a lot more cost effective to help people remain aging in their own home for as long as possible by providing them with some funding to set up their home and their lifestyle to stay safe and well. Now, it isn't just about snapping your fingers and getting access to a home care package. The process of getting access to one is calling the government department, My Aged Care, and booking yourself in for an ACAT assessment. Or if you're in Victoria, ACAS assessment. ACAT stands for Aged Care Assessment Team. You book yourself in, request that assessment, and an assessor will come out and spend some time with you, sometimes face-to-face, but also sometimes over the phone as well, to get an understanding of your needs and to approve you for the various levels of support and funding that you need. Now, for some, the process of going through the registration and assessment process for a home care package can be quite daunting or confusing or even frustrating, which is why Village Local exists. Village Local produces a lot of educational material about how to navigate your way through it and how to be really well prepared for a conversation with My Aged Care. And we've made that information really, really accessible for people and really easy to follow along with. We framed it all in what we call the CarePath Navigator program. And I've got the link on the screen as well. So visit the CarePath Navigator program at www.villagelocal.com.au/CarePath. You can enroll yourself into the program and then follow step by step how to go from articulating your current situation in a really productive way, listing out all your challenges and the things that you want to get help with, and then knowing how to ask for these certain things and know how to put yourself down the right paths of My Aged Care to make sure you get assessed for the level of support you need, and more importantly, you don't get under-assessed because you haven't said the right things that perfectly describe your true situation. Now, the CarePath Navigator program is totally free, so go and check it out. And I'll also put the link in the description and below as well. Now, we've talked about the Commonwealth Home Support Program and we've talked about home care packages. And both these programs, they're for longer term support services in the home. But My Aged Care also offer a short-term service as well. And these fall under what they call the short-term programs. And there's 2 types of programs that they offer under short-term. There is the short-term restorative care program, and then there's also the short-term transitional care program. They typically run for about 8 to 12 weeks each. The types of services that you can get under both these programs is pretty much the same as the home care package system. So domestic assistance, help around the home, gardening, transport, meals, allied health. The difference between the two is the restorative care program is for people who have noticed a decline in their health, a decline in their physical condition, and want to get back on track. And they don't want to see any further decline. But they haven't gone into hospital, they haven't had a hospital admission or anything like that. They've just noticed that they're not doing as well as they could be, and they want to get back on track. That's when you can call My Aged Care and request to be assessed for the short-term restorative care program. If, however, you've had a hospital admission and that might be a planned hospital admission or an unplanned hospital admission after you've had an accident, either case, on exiting the hospital, you can organize some support in the home to help you through that recovery period. That's what's known as the transitional care program. It's when you're transitioning back into the home. Okay, so for transitional care, if you're in hospital, restorative care if you haven't gone to hospital. Okay, so that's the My Aged Care offerings that I want to highlight. I'm going to mention one towards the end of the video, so another one towards the end of the video, so stay tuned for that. But I want to shift focus a little bit now to the next government department and the services related to that I want you to be aware of. And that government department is the Department of Veterans Affairs. So if you've served in the armed forces, well, the country salutes you by providing you with some support services in the home to help you age in place. And the specific program that I'm referring to is known as the Veterans Home Care Program. Now, the types of services that you can get, very similar to what My Aged Care offers in their programs. And on top of that, you can actually combine or tap into services from both the Department of Veterans Affairs under the Veterans Home Care Program, as well as My Aged Care's Commonwealth Home Support Program or Home Care Package Program as well. Just as long as you're not getting the same types of services from both organizations, you can have a chat with Department of Veterans Affairs about your specific situation to see how you can tap into services from both departments. And I'll put the phone number for Department of Veterans Affairs on the screen as well, so you can give them a call. So next on the list to talk about is community nursing. Now, community nursing is typically run at a state level. So Department of Veterans Affairs and My Aged Care, that's at a federal level. It's managed, the experience that you get no matter where in the country is going to be the same from a funding standpoint anyway. But the community nursing experience, that's run at a state level. So typically what the idea is to keep people out of hospital or to keep people from coming back to hospital after a recent treatment. Many health districts provide a community nursing approach. So what you need to do is you need to contact your local health district to find out if they are providing a community nursing service and how do you get enrolled into it. If you find that a little bit daunting on how to do it, you can simply ask your local GP and they can plug you into it as well. There's no specific funding amount or anything like that with community nursing, but the resources are significant in many geographical areas across the country. So it's really about understanding what your health needs are to keep you safe and well and prevent you from coming back to hospital and getting those services in place. The most common ones that I see community nurses manage is wound care, continence management, catheter management. So yeah, just a few common ones there. Okay, moving on. For the pillars of our community, the carers, there are two government schemes that you want to know about. The first one is the Carers Allowance, and the second one is the Carers Payment. Both these programs fall under the banner of Centrelink, or at a higher level, Services Australia. So that's the department that you want to sort of go down to tap into the Carers Allowance or the Carers Payment. What's the difference between the two? Carers Allowance, it's more of a supplement to help those who are providing a little bit of support to somebody. So that person might still be working, but they do support somebody in some sort of caring capacity. You can tap into a Carers Allowance, and that supplement is typically an upper cap of about $3,800 per year. So it's not much, but it's something to offset any costs that you might be incurring to provide that support services. For somebody that's providing additional services that prevent them from going to work, that's where the Carers Payment comes in. And a Carers Payment has an upper limit of about $1,002 per fortnight. So Centrelink is who you want to contact to get assessed and approved for either one of those programs. And the phone number, again, on the screen, 132-717. That's specifically the number for the Disability, Sickness and Carers line. Okay, so we're on the final stretch here. The next one I want to talk to you about is the Home Equity Access Scheme. This particular program is relevant for people who own their own home. It's not so much about how much funding the government's going to give you. It's all to do with how much equity you've built up in your home that you can then use, well, the government at least makes it really easy for you to tap into to put towards the support services that you need. And the good news is you can draw on this equity in a tax-free income stream, which is really, really good to make use of every equity dollar that you're extracting from your home. Getting started with the Home Equity Access Scheme is pretty simple. Again, contact Centrelink and tell them about your situation and they can step you through the process. Okay, last but not least, I want to talk to you about the GEAT program, GEAT. It stands for Goods, Equipment and Assistive Technology. This particular program like the first ones I mentioned, also falls under the My Aged Care government department, right? So they're the ones who manage the Geek program. And essentially what it is a way for people who are experiencing any sort of mobility challenge to access goods and equipment that might help them remain independent and continue living safe in their home, but also in the community as well. So the types of things, products really, that you can access under the Geek program are things like walking frames, toilet seats, rails, mobility scooters, powered mobility scooters, specific recliner chairs, hospital-style beds. The list is vast, and the process for getting access to this sort of stuff is contacting My Aged Care, telling them about the equipment that you need in the home that would make your life easier and safer, and booking in an assessment for that. And that assessment will take place, and then you can get properly assessed and approved for the right services or products that you might need through the Geek program. Now, we've covered a lot in a relatively short amount of time, and you may be feeling a little bit overwhelmed about navigating this whole process and the maze of it all. But that's where Village Local comes in. Really lean into that. You can ask us anything. You can put some comments in the section below with any questions. Our phone number's there as well that you can contact us with any questions. But I highly suggest get yourself enrolled into that CarePath Navigator program, because that's going to really step you through things in a really easy to understand, streamlined way. And it's totally free, right? So just check it out, and you're going to be better for it and be wondering why you didn't look into it earlier. I am going to produce additional videos specifically on the individual programs that I've mentioned, just to go a little bit deeper into those. So let me know what you want further information on first, and I can prioritize those videos. Put it in the comment sections below, and if you haven't already subscribed to the YouTube channel, in the bottom, one of the bottom corners, you'll see that subscribe button. Hit that subscribe button, because as soon as I release those videos, then you're going to be notified, and it's going to make sure that you're not going to miss any of the good information that we put out there. All the very best, and stay well.